we are going to study the topic hypoxia. What is hypoxia? It is the low levels of oxygen in the body tissue. The patient will present with chief complaints of confusion, restlessness, difficulty in breathing, rapid heart rate, and bluish discoloration of the skin. So, hypoxia is when the tissue of your body don't have enough oxygen. When you breathe, you take oxygen into your lungs, where it travels through your airways out into small sacs called alveoli. From there, it gets picked up by your blood in small vessels that travel close to the alveoli. Finally, it travels through your blood out to the other tissues. When this level of oxygen becomes low in your body tissue, then it is called as hypoxia. There are various causes which causes hypoxia, which we will study later. First, let's see the basics of it. So, we often get confused with hypoxia with hypoxemia. Hypoxia is a low level of oxygen in tissues, while hypoxemia, it is the low oxygen levels in the blood. So, the name sounds similar because they both involves a lack of oxygen but in different parts of your body. Hypoxia is often caused by hypoxemia, but not always. You can be hypoxic but not hypoxemic, and vice versa. How is oxygen transported in our body? This is very important. We have to see how is oxygen transported. It is transported in the dissolved form. The dissolved form is responsible for PO2, and some of the oxygen gets combined with hemoglobin. So this is how the oxygen is transported in our body. Now we will see the types of hypoxia. Okay, there are 4 types of hypoxia which we will see. It is hypoxic hypoxia, anemic hypoxia, stagnant or ischemic hypoxia, or histotoxic hypoxia. Okay, first is hypoxic hypoxia. What do we understand by this? Hypoxic hypoxia, it is seen at high altitude. We often see when we go to the mountains, we feel dizzy, we feel that we are not feeling well, we have difficulty in breathing, and we often have our skin color change to blue. So that all is caused by hypoxic hypoxia, because at high altitude the oxygen levels are very low, so we may suffer from these symptoms. And it is also seen in chronic obstructive pulmonary disease patients. Okay, so what is the mechanism of action? At high altitude, there is decreased dissolved form of oxygen. So we have already read that oxygen transport, it occurs by 2 forms: dissolved form as well as oxygen combined with hemoglobin. So when this dissolved form is decreased in our body, so it causes decrease in oxygen, decrease in PO2. So our peripheral chemoreceptors get stimulated. There are certain chemoreceptors in our body which senses the levels of oxygen, carbon dioxide, and H plus ions. So there are of 2 types: central and peripheral chemoreceptors. And here the peripheral chemoreceptors get stimulated, and what is the treatment given? We have to provide oxygen therapy to the patient for it. The next hypoxia that we are going to study is anemic hypoxia. Anemic, the name itself says about it. Anemic, that means the patient has less hemoglobin present in it. So it is seen in patients who are anemic, or patients who have undergone carbon monoxide poisoning. What is the mechanism of action here? First, it can occur due to decreased oxygen combined with hemoglobin, because in anemia the hemoglobin itself is low. So how is it going to be higher levels in our body when hemoglobin itself is low? And in carbon monoxide poisoning, there we already know that carbon monoxide poisoning has 250 times, carbon monoxide has 250 times more affinity, 250 250 times more affinity than oxygen. So there is high affinity of carbon monoxide to hemoglobin, so there will be defective oxygen release to tissues. And on oxygen dissociation curve, the curve will shift to the left side, which you would have studied that there's one oxygen dissociation curve, and on that curve the curve will shift to the left. Now the third type of hypoxia that we are going to study is stagnant or ischemic hypoxia. Stagnant means there is some stasis occurring, the blood is not moving. So what happens is the stasis of venous blood occurs, which causes increased oxygen utilization at tissue, and it increases the arteriovenous oxygen difference and thus causing hypoxia in the tissue. And the fourth type here, it is histotoxic hypoxia. It is seen in cyanide poisoning. So there are you must have read the poisoning of different substances. So one of them is cyanide. So what does cyanide do? Increase cyanide levels in the body. It inhibits the cytochrome oxidase enzyme, and it causes a defective oxygen utilization and thus decreases the arteriovenous oxygen difference. So what happens is the exact opposite of the stagnant or ischemic hypoxia. Here the oxygen utilization at the tissue is increased, while at a histotoxic hypoxia the oxygen utilization is defective. So the arteriovenous oxygen difference decreases here. And here again the peripheral chemoreceptors are stimulated. So we have read all the four types of hypoxia. Let's see again: hypoxic hypoxia, anemic hypoxia, stagnant or ischemic hypoxia, and histotoxic hypoxia.